I see, babies, days old. I've got a current young baby that we're working on now. But we see patients as old as in their 90s, right? And it's really just a matter of making sure that the body is functioning at its best. And there's no other, profession within the healthcare industry that really just looks at the body looking at it from a nervous system standpoint to making sure that you're not just functioning well to get rid of pain, but you're functioning well from a preventative standpoint.
The old time chiropractors used to go and sit with people who had illnesses, and they'd sit with them all night long and adjust them. I did it to my own child. My own child had repeated ear infections, and I refused to put him on any more antibiotics. And I remember one night when he had a high fever and he was a little baby, and I just sat with him all night. I must have adjusted him 10 times that night. And after that, he never had another ear infection. Freeing up the nervous system to function at its optimum level is what chiropractic is really about.
This is so important when we talk about integrative medicine, is to go to a chiropractor when it comes to integrative care. And here's why, is because you look at the body as a whole. Even if you know that there is a need for an ortho, or there is a need for, a medication in this case, or there's going to be a need for some, even surgical intervention of some sort, you know where to go and you become a very good hub. Hello and welcome to Polish Your Life. Today we're going to talk about integrative medicine, and we're going to talk about integrative medicine examples, because a lot of people understand what it is and a lot of providers have some difficulties actually applying it in their practice. So we're going to give you some examples. And as a provider, that it's very important to have multiple different disciplines working in collaboration to help your patients get better as fast as possible. Many times you already have multiple disciplines in your own practice, but many times you need to go outside of your own practice and collaborate with others. We're going to talk about that today. Feel free to ask questions in comments below if you have any questions, and connect with our awesome providers on this call. For those of you watching for the first time, I'm Polish Mike. I'm the group organizer, and I'm here with two awesome doctors. I'm here with Dr. Lisa Gordon and with Dr. Rochelin Herold. So I'm going to let our providers introduce themselves. Ladies should always go first. So Dr. Lisa, starting with you, how are you today?
Thank you, Mike. I'm doing well. And I appreciate your invitation to participate in this conversation. I'm a longtime chiropractor in Columbia, Maryland. I've been in practice for 34 years, and I have a multi-technique, multi-faceted practice. I'm the only doctor there, but I do a lot of different things. So in addition to doing chiropractic care, I also do a cranial technique called neurocranial integration. I pull a little bit from craniosacral because I have done that as well. I've been well trained in that. And I do a technique called advanced allergy therapeutics. And one of my main techniques is called nutrition response testing, which is a very holistic way of helping people's health get better by way of determining organ dysfunction, determining nutritional deficiencies, and providing exactly what might be causing that person not to be able to get well, and then giving it to them by way of nutritional supplementation and close monitoring over time so that they can get better. There are a couple other things that I do, but that's basically my practice. And I do have some patients who only do one of those things. And in terms of it being integrative healthcare, it's some of my patients do chiropractic with me only, and others do a combination of that in nutrition response testing, or they add in advanced allergy therapeutics, whatever that individual person needs. And then I have some new things, heart sound recorder and brain tap and PEMF. I do a lot in my little space. So, it's very individualized.
Awesome. And Dr. Roche, maybe introduce yourself if you don't mind, and let people know who you are, where you practice, and how you kind of like an intro. I know you even wrote a book about this, so there's a lot to talk about, but give people an intro so they understand how you practice integrative
Yes,
medicine.
there is. The book is not out just yet. Thank you so much, Mike, for inviting me out to the Polish Your Life podcast. It's hard to follow Dr. Lisa's great introduction, but I'm gonna try my best. My name is Dr. Rochelin Herold. I have two offices. There's one in Harford County, in Bel Air, Harford County, and then there's another one in the Bel Air Beltway Plaza in, let's say, the Overly White Marsh area, northeast corner of Baltimore County, Baltimore City. And we actually just rebranded our office. We used to be known as the Maryland Spine Institute. And because we've just been moving and kind of flowing in an integrative pattern in terms of our treatments and the practice philosophy, which, you know, has always been like that. We just decided to go ahead and rebrand. So instead of Maryland Spine Institute, we've just rebranded to MSI, Integrative Healthcare, because we felt like integrative healthcare was the healthcare of the future. In our practice, we have had everything from in the past, from acupuncturists working with us, massage therapists, most recently nurse practitioners. Currently, right now, the new building that we're in, our office, we just basically moved into a brand new, fully renovated facility inside the Winters Run Professional Center. And within that center, there's also physical therapists, there's massage therapists in that center, and there's also an orthopedic surgeon downstairs that we're going to be working with as well. So inside the walls of our practice, we have many different modalities, from a revolutionary modality called Shockwave, which has been really eye-opening and life-changing for a lot of patients that have not had help with a lot of musculoskeletal conditions and soft tissue, either disorders or just malfunction, where they haven't had help in a lot of different other disciplines. We do spinal disc decompression for patients with sciatica or disc degeneration. We have cold laser for also soft tissue injuries and sports injuries, athletes, and things of that nature, carpal tunnel syndrome. Of course, chiropractic, that's our bread and butter. You know, Dr. Lisa, I tell our patients that chiropractic is like the best kept secret in healthcare. So we start with that as a foundation, but we also do a good bit of physical therapy as well. Many of the patients that come to our office, they're amazed at how much physical therapy that they're doing in conjunction with the chiropractic and maybe some of the other modalities and products and things like that that we offer. So, it's a great time to be a chiropractor and to treat. There's, Dr. Lisa would agree, there's plenty of people out there, they are not getting the help that they feel like they need to get within this current healthcare system design. And Mike, that's what I'll mention. You mentioned that the book is still in writing, and I'll let you know where to get more information about it as well. But I felt led to write a book ever since the pandemic started, and I'm still working on it, but it's called Dare to Live Well. And, really trying to help people find a way to build generational health, not just taking care of themselves, but how can we take better care of our families and the people around us?
Wow. This is really, really awesome. And I wanted to give people some real life examples of how integrative health and integrative healthcare can actually take a patient from the patient's perspective, and then actually, instead of making it the journey longer, because they are seeing other providers and they are getting multiple different treatment modalities, then it actually shortens the journey because it saves them time when it comes to the outcome. So let's talk about this. Maybe Dr. Lisa, you could start with some examples how it does look in your practice in collaboration with others. And then I would like Dr. Roche for you to also talk about it as well. It would be very important.
So there are two answers to that question that I can think of. One is, how does a patient move within my practice, within the different things that we do? And one example of that is, for years and years, I had patients coming for chiropractic adjustments. And you are absolutely right, Doc, that chiropractic is the best kept secret. Everybody should have a chiropractor.
Yes, ma'am. Yes, ma'am.
Well, we know this, right? It's part of our world.
You're preaching to the choir, ma'am.
I know that. And so, you know, however, if there are underlying issues that are causing a person not to be able to hold their adjustments, in other words, not to be able to just continue to make progress, but rather to come in and be glad that they're there for their adjustment, and then, you know, maybe they're on maintenance and they come in every 2 weeks or every month and they can't wait till their next adjustment because they just keep going back to the same symptoms. What I found in my practice is that if we can get to the nutritional piece of it, then a lot of my patients who were coming in just in pain every single time, every single 2 weeks or every month, are now coming in because they just know it's good for them. They don't really have the symptoms anymore because some underlying things are being handled. Maybe their liver, or their kidney, or their heart, or their thyroid, or their brain, or who knows what could be interfering with their holistic ability to heal. So the structure does not exist by itself. It's a whole person. So there's the structure, and there are the organs, and there are all the different parts of the person. Some people would say, yeah, and what about my emotions and my spiritual life and everything? And yeah, that's not really our wheelhouse, if you will. We're more in the physical aspect. Most of us are, I am. And therefore, if somebody's physical body is not in good shape, they really can't be healthy on any of those levels. So that's one way that I work within my practice to identify people who might need a little bit more care and then add something. And then there are those people who I find there's a way that people can kind of get stuck in various ways in their body, in their flow. I think of it in like their flow of themselves, like their hip might hurt and we just can't get it beyond because they have some kind of lockedness of some kind that I'm not getting to. Then I would probably refer that patient not to an orthopedist because I can tell they don't have problems with their range of motion. I've gotten their muscles better, the light switches are turned on and everything, yet still there's this level of congestion, I would call it. That is a person that I would probably send to an acupuncturist. And I've had acupuncturists who can't get beyond a level because of the structural piece. So they'll send a patient to a chiropractor because we need to get that person adjusted. We need to get the joints realigned so that they can do better work on their end. So that's a really good way of working together. And then there are the people who really are need their medical doctor. I have a patient, this is my latest absolute miracle. I had a patient who was ready to go on dialysis and her medical doctors were really threatening her with dialysis. And she's, if it goes down any lower, it's going to be dialysis. And she doesn't want to go on, who wants to go on dialysis? But she doesn't want to go on dialysis. So we started working with her kidney function being around 14, a level of 14. And 12 is where there's no question, you either go on dialysis or you die. So we're working together with nutrition response testing. And the other day she told me that she went to her doctor and her doctor was staring at his computer just dumbfounded because he says, I've never seen this before, but your numbers are up now at 21, your kidney function. He's never seen it before. Did he ask her what she was doing? No, but she was dying to tell him. But people think they need to keep us a secret. It's so silly. But I was literally jumping up and down because I was so happy. And she's so happy. So she obviously needs her medical doctor to look after her kidneys and her kidney function and whatever medications she's on. We obviously don't have a license to prescribe medication. So if a patient is on medication, we also can't take a patient off of medication. So part of this integrative thing is as the patient starts getting better, the patient needs to go to his or her medical doctor to work with them to help them to get off of their medications, because people could start getting side effects from their medications as they're getting better because they don't need as much. So then, you know, they like to blame it on us, and the medical doctor might say, stop going to the chiropractor. You're getting better. We need you on this medication. They get all confused. So anyway, all these things have happened.
You know, it's funny you say that. I always tell patients there's a reason why, you know, you may not see a chiropractor in every single, you know, hospital and health setting. I mean, you know, we actually, you know, patients do get better, and patients, you know, as they get better, they do need less medication. And there is a reason when patients are like, hey, well, how come, you know, I didn't hear about you from here or from there? I said, well, you know, we do tend to have patients not rely on medications as well. You know, Dr. Lisa, if I could step in, you know, the founders of Chiropractic, they said there's three causes of subluxation. What is a subluxation? A subluxation, it can happen in any joint, anywhere really in the body. Chiropractors, we focus on subluxations, which is a joint that's out of place, and it's affecting how well the joint, the area of that joint is functioning, or it's affecting the nerve that passes through that joint is functioning. That's how I usually try to simplify it and break it down. So the subluxations in the spine are the most important. Why? Because your nerves are the most sensitive as soon as they exit from the spinal cord. So if we put all of that together, that's why most chiropractors, they'll probably start by trying to figure out, is there any subluxation that's going on in the spine? So the three causes of subluxations are thoughts, which of course has a lot to do with mental health, and there's a psychosomatic response to stress. And every time when patients are stressed, they feel like their shoulders are getting up, their back is tight, they feel all of these physical things that happen, even though they're mentally stressed. You know, those are like the teachers, the firefighters, the police officers that we treat, and it's a stressful job, it's a stressful career, and you see it show up in their body. So how can we, so yes, we'll deal with the physical stress that's showing up in their body, but I mean, just this week, there were 2 patients that I had to give them referrals to mental health therapists, and I'm glad that they took my advice and decided to do that. That's even one way, Mike, where that's an integrative approach. You know, a doctor that's just going to say, okay, well, I'm just going to adjust you and maybe that'll help you get rid of your stress. No, you need a therapist. You know, you need somebody to help you deal with the thoughts. That's one of the ways that causes subluxations, right? The other ones is toxins, and that's what Dr. Lisa's kind of dealing with when she's talking about nutrition, and she's dealing with, you know, what are some of the chemical imbalances. And when you look at the foods that we're eating and the GMO and the, you know, gluten, non-gluten, and you're looking at all these different things that's going on in the food industry today, there's a lot of toxins within the foods that are right in the supermarket. And, you know, we're buying and we're filling our shelves and our fridges and our refrigerators with so much food, but some of it, you know, we really don't know, is this like real good? Is this, you know, real good nutrition, or has this been, you know, genetically modified, or is this, you know, affecting me in some type of way? So I think it's good to do some nutritional testing as well, especially when we realize that there's something going on. There's a reason why they're getting adjusted, but we call that, you know, the patient getting into the stabilization phase. You know, it's one thing to get out of pain. It's another thing to be more stabilized, and then you're getting more into the maintenance phase where you're coming in and you're really just kind of making sure things are staying in order. But Dr. Lisa, if we can't get them stabilized, it's either the thoughts, the toxins, right, that you deal with, or there's some deeper traumas that's within either the soft tissue or the joint, and that's where some of the things that we deal with, such like the Shockwave that I was telling you about, like even earlier today, one of my last patients, she has severe scoliosis. She's been riddled with pain. She's got all these issues going on. You know, we perform Shockwave. Shockwave is more of a regenerative therapy where we're using, it's a new specialized machine, and it has many different heads or applications that you can apply to the machine. And basically what it does is that it breaks up the hardened tissue or the damaged tissue from like an old injury or sports injury or just chronic hard, like many people, they'll go and get a massage, but there's always a knot that's always in that left shoulder, or there's always some tender spot that's in a certain area of the body, that's what I would use Shockwave for. When I would adjust them, they would do massages, they would do all these things, cupping and everything, but yet the symptom is still there, the condition is still there. After I've done Shockwave, it's miraculously been really helping to alleviate and just reform that area of the soft tissue, because the Shockwave breaks up the hardened tissue and it stimulates the natural stem cells that we have in the body to almost reform new soft tissue within that area. And then that's where I have the patients, okay, now go do a massage, now go and do these therapeutic exercises, and you'll see how the patient changes. So even the patient earlier today, severe scoliosis, but she told me like after 2 sessions, and she showed me how far she could bend back and bend forward. And these are things that she could not do without severe pain on her first visit. So that's just integrative, that's just using integrative healthcare, using different modalities, Mike. But then this same patient, I also had to find her a real good orthopedic, because there's some neurological and biomechanical things going on with her scoliosis. I think it could be affecting her spine in such a way that it could be beyond our scope in chiropractic. So I don't want to let her know that, hey, look, all you got to do is stay holistic and you're going to be fine. No, this, some of this, we might have to co-manage this. And I know a great orthopedic that we work with, and I want you to go and see him. And she was actually turned off in all of healthcare because the last orthopedic that she went to just, dismissed her, made her feel like, like she was just crazy because she was having all these pains and aches and discomfort. And she just said, she just wrote it off. So for like the past 5 years, she didn't want to see anybody, Mike, right? And she decided, I think she got referred to our office. She started to see some improvements, and I had to kind of talk her back to saying, hey, look, I don't want you to write off all of medicine because you saw one bad doctor, right? Let me find the one that has a great bedside manner, the one that's real good. He's well known in town. Go and see this guy, and let's see if we can kind of work with you together. One more example, and Dr. Lisa brought up acupuncture. I actually do the same thing. When there's patients where you could tell that there's just something off. Like most patients, and I said this today, most patients, not to pat ourselves on the back, Dr. Lisa, but
let's pat ourselves on the back. We're doing awesome work.
If it's a biomechanical issue and somebody, even if they've been here, there, and there, if you just have a real good chiropractor to really find what's the root cause of the problem, address that issue and work on getting better motion, better alignment, and less stress on the nerves within that area, you're going to get relief. So we see relief with almost 80-something% of the patients. So the patients that don't improve at a chiropractic office, especially ones like ours where we have multiple modalities and ways to get people better, if something is off, something is not working. We've done spinal decompression, we've done cold laser, we've done shockwave, and something is still off. That is a perfect patient to say, hey, look, have you tried acupuncture? And those are the patients where I've done in my other office in Overly by the Beltway Plaza. She had knee issues, a lot of swelling. I knew there was a lot of just consistent swelling and inflammation. I knew that the swelling was probably more systemic. So I had to go to an acupuncturist, and she's been seeing great results as well.
That's great. The other thing that I hear from, I'm not sure how long you've been in practice, Doc.
About 12 years.
12 years. So this might sound that you might relate to this. The thing that makes me really sad about what's happening in chiropractic is that because of the insurance industry, chiropractors are usually thought of as being back and neck doctors. And, the open-minded ones think of it as sports injuries, and it's all about injuries and pain. And that is not what chiropractic is. Chiropractic is a way of helping the nervous system to function well so that the organs can heal, so that the nervous system can be appropriately running from a bear and resting. And, because so many of us are in this constant fight or flight, and chiropractic can handle so much of that. And the old time chiropractors, used to go and sit with people who had illnesses, and they'd sit with them all night long and adjust them. I did it to my own child. My own child had repeated ear infections, and I refused to put him on any more antibiotics. And I remember one night when he had a high fever and he was a little baby, and I just sat with him all night. I must have adjusted him 10 times that night. And after that, he never had another ear infection. So those kinds of things, colic, ear infections, you know, rashes, all these things, chiropractor, freeing up the nervous system to function at its optimum level is what chiropractic is really about. And it just makes me super sad to see that people say, oh, I never really needed a chiropractor. Well, yeah, you did. You did. You know, did you need an auto mechanic? Did you need a dentist?
No, that's so true. That's so true. It wasn't until about the maybe 70s or so, where, you know, when you know, with the rise of the insurance companies, but people, you know, in the past, people would see chiropractors for all sorts of issues and see results as well. But ever since, you know, we had to have a diagnosis and a treatment code to kind of bill under, then it's really just kind of been lumped under the neck pain, back pain. Oh, yeah, you know what? The research has shown they're getting good results with headaches too. But with us, you're right. I mean, you know, my youngest patient has been days old. So I have patients where they bring their kids. I have a family that comes from Delaware. We're in Harford County, so it's about 40 plus minutes away, but they come from Delaware. She brings all of her kids. And, you know, I see, you know, babies, you know, days old. I've got a current young baby that we're working on now. But we see patients as old as in their 90s, right? And it's really just a matter of making sure that the body is functioning at its best. And there's no other, you know, profession within the healthcare industry that really just looks at the body from looking at it from a nervous system standpoint to making sure that you're not just functioning well to get rid of pain, but you're functioning well from a preventative standpoint, and that we're looking at issues before they start. And that, I tell some patients, that's some of the best benefits of chiropractic. It's not only just getting rid of the pain that you came in with, we're getting rid of things that were going to lead to surgery had you not done chiropractic. Things that, you know, when you see degenerative disc on x-rays, we take x-rays in our office, and you see the rate at which, you know, I have a young lady right now, she's probably, you know, a teenager, but she's got multiple discs that are degenerative. You know, she did gymnastics, she did cheerleading, and she's a dance, and she's just done so many things that basically has caused a lot of degeneration in her lower back and spine. And, you know, it's either, and the mom is saying, hey, look, it's either we're putting her on in pain management at 14, or she's coming to an office like ours where she's starting to see results and she's starting to get, you know, some good days, some bad days, but she's seeing improvement. And it's just a different way of managing how well the body is working. And can we remove the interference, as what you were saying, allow the nervous system, which controls every cell, tissue, organ in the body, can we get the nervous system to function as best as we can, especially within the arc of life, which is in the neck, where the spinal cord is the thickest and the bones of the spine are the smallest. But that area has so much neurology and so much impact on how the body functions. And if you can just get the proper alignment and proper motion into the spine, so many things just tend to kind of follow afterwards. So I mean, you know, we could sit here all day and tell you story after story. You know, one more, I have one patient, she's been seeing me, oh my gosh, I want to say, you know, she originally came for neck pain, tension, tightness, you know, stiffness in the neck and upper back, but she was taking, I want to say it was Zoloft. She was taking something that was something for like her anxiety and all of that. And ever since probably like maybe like her third or fourth adjustment, I mean, she told me she has never had to take anxiety medication. I might see her maybe like once a month. Now, I'm not saying we do that for everybody, but for this particular woman, she said that she has never felt the need to take any type of, you know, anxiety medication or anything like that. And that's just from her coming with chiropractic. So that goes right to the point that Dr. Lisa was saying, where it's really just, you know, it's more than just neck pain, back pain. Can we get your body functioning better at its best And if we can do that, a lot of times, the body's going to do the rest.
Yeah, that. Well done, Doc. Well done. And I'm thinking about that teenage girl, the gymnast. How are her periods going to be? How are her hormones? Is she going to end up with less cramping during her menstrual cycle than she would otherwise, because you're working on her back like that? And guaranteed it's going to be different. It's not even, I don't even have to guess or wonder. Those nerves go to the reproductive organs, and a person who has disc problems or compression on a disc, or the subluxation in the lumbar spine, guaranteed is going to have worse periods than she would have otherwise. Worse digestion, all different sorts of things are being affected. They come in for the one thing, and they, it's up to us to educate them. Hey, this is all connected.
And that's also, I'm so glad you brought up the reproductive, because I put a mental note to make sure I mentioned the huge benefits of chiropractic with pregnancy. So,
how do people go through pregnancy without a chiropractor? I have no idea.
If there was one thing that I think would be just malpractice, it would be not recommending a good chiropractor to every pregnant patient that's out there. It's amazing, isn't it, Doc? It's amazing. But we've seen a huge onset of pregnant patients over the past year, just, of course, with the pandemic, and you've seen the rise in pregnant patients. But it's, to me, there's certain groups and populations that I feel like it's just mandatory. It's not even a question. And the pregnant population, if anybody's listening to this and a woman that they're thinking about, being pregnant, or they're currently pregnant, please recommend them to a good chiropractor. It will dramatically reduce tension in their lower back, their mid back. It'll allow better communication between the nerves and their reproductive organs. It'll reduce the sciatica, the carpal tunnel that typically comes with pregnancy, the headaches, the swelling in the feet. There's extremity adjustments that can happen. I mean, I can go on and on and on, but the pregnant patients that we've had have been nothing but thankful. But it's almost, I'm mad, you're right. It's almost like they kind of had to stumble into the practice as if they heard about it through the grapevine or through some,
then they got to keep it a secret,
like, because it wasn't a mandatory thing. Like, oh, by the way, you know what? I'm pregnant. Hey, you know what? I need to start looking for a good chiropractor.
Right.
Like, you can
just like they look for their good person who's going to deliver the baby.
Exactly. Even with the deliveries, I've seen where, because they were coming, I've had patients where they've had, maybe one or two children, and then on the third one, they've seen, because they were having complications or this and that, they've seen just a difference in the delivery, and just overall, just the pregnancy was just a better experience. It's unheard of that patients come in and they might be in like their first or second trimester, and they're feeling better in their third trimester than they did. Usually you think when somebody's pregnant, they're going to just get worse and worse and worse until the big day. But I always tease them. I say, hey, you're in your third trimester. Shouldn't you be at your worst right now? And they're like, oh my God, I'm feeling so much better than when I first came. Isn't that like a misnomer?
Yeah.
Right?
Yeah. So I will add one more.
The usual.
To the pregnancy part, I want to add one more very, very important thing that a lot of practitioners don't think about is a lot of women really get stressed out when they find out about the position of the baby. And then if we're talking about the breech position, and chiropractors who are trained in Webster technique, it's amazing. And like even within our family, we have experienced that. Yes, maybe it's a coincidence, but if you do it over and over and over again as a practitioner, and you see a pattern that a good percentage of your patients are able to, oh my goodness, this is so powerful. So we touched on a lot of different touch points of how chiropractic helps and looks at the person. And at the same time, that's why I think this is so important when we talk about integrative medicine, is to go to a chiropractor when it comes to integrative care. And here's why, is because you look at the body as a whole, even if you know that there is a need for an ortho, or there is a need for, a medication in this case, or there's going to be a need for some, even surgical intervention of some sort, you know where to go and you become a very good hub. I remember having lunch and learns back before COVID with a lot of medical doctors on behalf of chiropractors. And now we're talking about pediatricians. We talked about it just a second ago. They opened their eyes and said, I just never, I have all these doctors come to me, but not really chiropractors. I'm like, I wonder why. Because if there is a car accident, even car accident, and you have this child with trauma, what's going to happen to the child's spine and health as a result 10 years later? And now when the pediatrician understands it, it becomes a very good relationship, because then the whole family that was involved in a car accident can come to a chiropractor, but also it forms a bond between these two practitioners and the mutual understanding of treating the same person from multiple different angles. I think what you mentioned with ear infections is another very eye-opening topic to a lot of pediatricians, because what the standard of care says is do nothing or antibiotic. And now both of them are questionable. Do nothing, say, so why did I even come? Give me antibiotic. If it's not really sure that they're going to help me, then there is a question mark. Let's put it this way. So now if there is type of treatment that can have a high likelihood of helping, especially if the reason for that congestion and other problems is in the spine, how about we at least try an adjustment? It's safe, it's effective, and then we evaluate right after. So what we mentioned here, and for all of you watching, I think this is something to really consider, that when you talk about integrative medicine, when you talk about which provider do I see, it almost doesn't matter where you go first, because if it's a truly integrative healthcare practice and they care about you and your health, they're going to refer you to the proper next step and the next specialist. But knowing that there are people like within our group who truly care about you as a patient, or if you're a doctor watching this, or a acupuncturist or other practitioner, just keep in mind that having a network where you don't have to have all these answers is very comfortable for you, because you can just connect with others and say, what do we do with this? It's a complex case. Have you guys had experience with this? Versus a lot of people, what I have witnessed talking to individual practitioners, they're kind of afraid of functional medicine, integrative medicine, and things that sound like they are not really trained in that, because they think they need to know before they make a recommendation. Where it's the other way around. If you're a practitioner watching this and you feel like you don't know about something, reach out to the group, even connect before you make a referral, have a conversation. And a lot of times you're going to find out that something that maybe you didn't even consider as a good solution is exactly what you should be doing. We had an interview with Dr. Usman Zahir, who I want both of you to meet virtually or in person. He's an endoscopic surgeon. So while in the chiropractic world, you're trying to do everything to prevent surgeries, if the intervention is actually needed at this level, how about we just do less than 1 centimeter, intervention versus, a full fusion, and a lot of single disc herniations and other problems with stenosis and other things can be helped with that. So I find it really fascinating. And I wanted to give people a kind of like an inside look of the back-end conversations we have in the group between providers, because it matters much more than a referral that goes from one doctor to another or one practice to another. It means a lot to a family who is just receiving a much better outcome, and actually faster. Even though it was more appointments, they were nicely synchronized in time. So maybe one of you could talk about the referral process. How does it actually happen? Let's say somebody comes to you and you know that they will need maybe 2 other practitioners. Maybe they will need a personal trainer, acupuncturist, yourself, and an ortho conversation. How does it look like from a practical standpoint?
Well, I typically just give the person a name, and then ask, then in their own time they'll call if it's an acupuncture. If there's some urgency about it, I might call. I mean, early in my practice, somebody came in and it was very clear that he shouldn't be in there. He needed to be in a surgeon's office, and that's how I met the surgeon. That snowy night, I just found out who the surgeon was and that chiropractors refer to, and and that guy was in surgery that night. And so that was a personal phone call because it was urgent. And so it could go several different ways. I like to get to know different practitioners, and sometimes it's just hard to get together because we're all busy.
Yeah.
Maybe there's a phone call or something,
Yeah. Hey, you know what? We just got to get to know practitioners on this Polish Your Life podcast, where he's connecting different practitioners. But
yeah, it's nice.
But yeah, we are all busy. It is tough, and I think it goes back to what Mike was saying. It's just about trust. Because yes, I think sometimes there is the fear of the, they don't know what they don't know. So because they don't know, they don't want to refer their patient to something that they don't maybe know too much about, like every time. But, I always tell patients, it's not up to medical doctors to know everything about chiropractic. They have to know everything about managing your life from a medical standpoint. That's what they're trained in. That's what they went to school for.
Yeah, I mean, people tell me often they have a medication. I don't know what it is.
Yeah, but they do a great job doing that. So
yes, they do.
That's their bread and butter. But same similar thing where if somebody comes in and they need surgery, or they need a neurologist, or it's beyond our scope, of course we do an evaluation in our office. We have digital imaging and things of that nature. But if they do need anything further, then we've got to refer them out to the right practitioner so that they can get the help that they need. Even when you mentioned auto accidents, Mike, it hurts me that many times, almost every single time when I haven't, we see a lot of patients in auto accident cases and auto collisions and things of that nature. And the first thing I ask them is, who else was in the car? And many times they'll say, oh yeah, well, my daughter, who was 5 years old, was in the back. And I don't even ask if they're okay or not. I say, okay, well, bring them in and let them get checked out. And many times they'll say, oh, well, they're fine. They just said that their head hurt the first day, but after that, they're fine. When you do the exam and you press on certain points where you look for what's called, the subluxations, or you even just, not even subluxation, just feeling the muscle tone, and you're just palpating, and you see that they're wincing and they're hurting in certain areas that they wouldn't just verbally tell you that they're hurting, because kids don't really register things. They don't really know to say, hey, my neck is hurting, unless it's really, really severe. So, in auto accidents, even in an adult, if it's 6 to 8 miles an hour, that's enough to cause soft tissue damage. So how much more is that doing that in a child? And those are the things when I get in front of pediatricians, that's what I try to educate them on and say, hey, look, if you did have one of your patients, they were involved in a car accident, please have them see a chiropractor. It's not going to be a long, drawn out, 15, 20 visit, plan. It could be something as long as maybe just get a couple of adjustments just to kind of at least reset the joints and make sure things are not stuck. And it doesn't cause things down the line. There's so many patients that I have in their, early mid-20s. And when I do their history, Dr. Lisa, and I try to find out, well, why did all this pain start when you were 15, 16, 17? Then you get into their history. Oh, I was in a bad car accident at 13. Oh, did you see a chiropractor? Did you see a physical therapist? No, I was fine, right? But yet they've been having headaches since they were 16 years old and on medication and all of that, seeing neurologists and doing all of this stuff, right? So it's like, once you put 2 and 2 together, it makes sense, right? And it just goes back to the spine. It goes back to the body properly functioning the way it's designed to function.
You're very well spoken, Doc. You're a good educator.
Well, thank you. You know what? That's my master's is community health education. So I thought I was going to go a different route. And then when I went to chiropractic, I always wanted to, especially with chiropractic, because, every time that somebody comes in, Dr. Lisa, I don't know. One of the first questions I ask is, have you been to a chiropractor before? And then if they say yes, I have to say, okay, was it a good experience or a not so good experience? Because not all, chiropractors are not like McDonald's where you get the same Big Mac at every store. It's very different, right? Yeah. Even if you have 10 chiropractors on the same block, they will get 10 different, adjustments and techniques. And that's great. That's the beauty of our profession. There's a huge diversity of disciplines, even within the chiropractic profession, that many people don't know about. But then I go from there to just educate them. Okay, well, this is what we're going to do here. and this is how we're going to work, and this is what we're going to do, and then we kind of go from there. But we're real big on patient education, because the more the patient understands, the more I don't, the more that they understand, the better it is for them and their family.
Yeah, I agree with you. I feel like, when patients come in and they're really in either pain of some sort, ill health of some sort, there's some real lack of control that they have over their body and over their health. They just don't know what to do. And so part of our job really is to help them little by little to regain control, so that they have more choices about what they do and how they move and what they eat and how they sleep and all those kinds of things. Because they're so unsure. A lot of people come into us pretty desperate.
Yeah. And in pretty bad shape. And the fact that we get the results that we get, and I think, I forgot who would, but, I think in school they told us, it takes, I think some of the polling that they did, I think it might take somebody maybe an average of like maybe 1.5 to 2 years now. It's probably lower, but maybe 1.5 to 2 years before they even go and see a chiropractor. So let's just say if, somebody's cousin say, hey, I got a great chiropractor, you should see them. They're going to think about it. They'll still go through the pain. They'll see the ortho. They'll see PT. They'll do this, that. And then if the issue's still going on, they'll be like, all right, now what's the name of that crazy chiropractor that's in Bel Air?
That's exactly what happened to me.
So that's usually about, that's usually about 1.5 to 2 years. So the fact that, the fact that we get that much people better, right? Even when they wait that long, I think it just says, it just really speaks highly of the profession. I think we're real proud, to be where we are and do what we do. And in wrapping up, what I tell a lot of patients is I always tell them about how the body can degenerate over time. And I tell them a good chiropractor is only as good as the joint space that we have to work with. But people have to remember, once that body is degenerating and the disc space goes from here to now the disc space is like phase 4, and now, you've got constant pressure on the nerve. You have a complete disc, a bulge. And, it's just, very arthritic. And I tell patients that it's better to start earlier, right? It's better to start earlier while you have the motion, while you're not in that much pain. Once people wait and they kick the can down the road, I tell them, we have a small window of opportunity once the discs start closing, Mike, and once, things start really getting to a point where, I'm sorry, but the surgeon might be their only hope, and I know some great surgeons, there's some great docs, and if anybody's looking for surgery and they're saying, hey, look, I've done X, Y, and Z, I know great surgeons, and that's part of being a good integrative healthcare practitioner. Great doctors. It's almost like a circle of doctors, right, Dr. Lisa? Yeah. It's a circle of doctors that we have, and I know I'm one of the best chiropractors in the area. So if I can help you, I want to send you to not a mediocre surgeon. I want to send you to one of the best surgeons in there. I want to send you to one of the best orthopedics or acupuncturists in the area, right? So you can get the same level of care that you would get in my office, but with a different discipline.
Wow. This is so important for people to know. And this video is more for providers than it is for patients. So just remember to explain to your patients when you are communicating with them, because there's a couple of very important things that Dr. Roche and Dr. Lisa were talking about today. One of them is that the patient has a choice, that the patient is actually in charge. And sometimes the patient doesn't know, because we are used to the old school mentality that I have a problem, I go to a specialist, and then the specialist is going to tell me what to do, and they're going to fix me with either a pill or a workout regimen or some sort of exercise or a magical thing that they're going to do. And that's great if it works, but what if it doesn't? And many people, I keep talking about it because I feel like this is a major problem. Many people go from doctor to doctor, from a specialist to a specialist.
All the time.
They follow recommendations. And even if they follow recommendations, a lot of them are still not getting better. And then what? Who is doing something actively to actually change it, to give them the hope? So one thing we are creating here within the group is we are creating the whole energy behind the power of all these amazing practitioners that you're witnessing here. And the individuals who are also passionate about health and looking for clinical solutions, if all of them start collaborating, now we are putting a big dent in that big problem. Because now we know that what you mentioned, Dr. Lisa, is so true. Healthcare providers don't have enough time to collaborate. Absolutely. So that's why having a shortcut and saying, hey, in the group, just like somebody posted today, say, hey, we have somebody with glaucoma and this is the type. And like, is there a practitioner here who can refer me to or guide me to the right person? And I'm thinking, oh my goodness, this is exactly what we are talking about, because when we scale this up and when we get more practitioners here and we educate the practitioners to not only talk to their patients for their own benefit, but also educate about integrative healthcare, this is the power, because now we are empowering the patient and giving the dentist example even is like, yes, you had a bad example in that dentist, doesn't mean you have to like forget about dentists until you're 87, right? You need a dentist, you need a chiro, you need a good team of people, but sometimes even for patients, they don't have time to research, especially when they're diagnosed with something and they feel like crap. This is not the moment to do research. This is the moment to go to somebody and say, hey guys, help me. But where is that place? Like, how many places do you know that are actively collaborating like we do here? So I appreciate you so much spreading the knowledge, sharing, that energy of actually something bigger than just one office bubble. Even though within each other's bubbles, we all have our amazing success stories, but many times we know that collectively we can do much more than just within individual offices. So just wanted to ask you before we wrap up, if there is anything that you feel, both of you, if there's anything we need to add. We can for sure talk for 2 hours about this, and nobody has that time. But I wanted to make sure that if there's something that you feel like there's this one little nugget you forgot to say, let's make sure we say it now, or we can wrap up and do it in the next video.
Well, I just want to say that a lot of my patients have another chiropractor and they like that chiropractor and they come to me for one of the other things that I do. And I'm always very respectful of that relationship with the other chiropractor. I want to make sure that, I'm not kind of taking other doctors' patients. And oftentimes I'll say, you need to get to your chiropractor. You need to get an appointment, because what I'm finding needs an adjustment. And I'm not going to adjust somebody who has another relationship with a chiropractor that they like. So I think that that's part of the integrative thing. Yes, I do all those things, but do they have someone else that they're working with? Then that's the relationship that needs to be respected as well.
Very respectful. Dr. Roche, anything you would like to add or leave our viewers with so they can just maybe have something to think about?
Yeah, I mean, well, you said if this is for providers, if this podcast would be more for providers, and I'd be reaching out to, other healthcare practitioners and providers, I would say I think that, everybody needs a good primary care physician. That's actually one of the things that I really stress in the book. Even though I'm a chiropractor, I'm really supporting people to have a very good, open-minded primary care physician, because the primary care physician, the way the healthcare system is designed currently as we speak, the primary care physician is like the bedrock of prevention. If we're going to do anything to decrease our healthcare spending and to help people, live longer and not die from all these preventable diseases that are growing, still at a rapid pace, then, everybody needs a good primary care practitioner. And from there, that primary care practitioner needs to, at least, I think it's on them to at least know, if they don't know, a good reputable, good, chiropractor, holistic practitioner that can treat their patients. I would say at least listen to a broadcast like this, or at least ask around, or maybe just check with their patients, say, hey, have you had good success with chiropractors, and find out from your patients, and your patients will tell you, that, oh my gosh, yeah, chiropractic is amazing, and I do X, Y, and Z, and I would just, encourage them to make sure that they're partnering with good chiropractors. The same thing with pediatricians as well. So, I think the healthcare system works better when there's more collaboration and there is a synergistic flow of patient care and people get better because they see that there's multiple people working with them from multiple angles trying to get to one goal, which is getting them better so they can live their lives and do the things that they love to do. So, that's pretty much it. I had a great time. Thanks for the invite.
Awesome. No, thank you guys. This is really, really amazing. It's meaningful because a lot of people, providers watching this, and even patients watching this, it opens their eyes to these conversations that we have. And, so many people complain, and do we have reasons to complain in our current healthcare system? Probably, right? Yes. But do we have reasons to be happy? Do we have a lot of technology, amazing people who are willing to collaborate and make the healthcare better? For sure. And then if we collectively, we start doing something together and then promoting this as a concept and just spreading the word and helping each other and supporting each other, that's where real magic can happen. So big thank you to both of you. You are both amazing practitioners, and we're going to definitely do some sort of part 2, maybe on specific topics. I want to thank you for watching as well. If you are a provider or an individual, you may have a question. Feel free to comment below. Definitely connect with Dr. Lisa Gordon, with Dr. Rochelin Herold. They are awesome. And then if you have any questions about the group, just comment below, let other people know about this, join us. We have a Facebook group. It's called Polish Your Life Doctors. So you can go to facebook.com/Polish Your Life Doctors, and you'll be able to join. It's coming back to what Dr. Lisa says, nobody has time. This is not a typical networking group where you have to show up every week and you have to pay the fee and you have to do all these meetings. You participate as much or as little as your time allows, but we're here for you. So wishing you a very good day. If you're watching this on YouTube, please subscribe. If you're watching on Facebook, follow us because of the amazing practitioners. So once again, thank you so much. And I wish everyone a great day, and great to you guys. Thank you.
Thanks, Mike.